Good evening, everyone. Welcome back to You and Your Health. I'm excited that you're able to join our program this evening. So, if you're watching the program for the first time, my name is Erika Roberts, and I also have a co host for this program, and that's Dr. Edward Asuman. Dr. Eddie, are you there?
Yeah, I'm here.
Hi, Dr. Eddie.
Hi, Erica. How are you?
Fine, thank you. Happy Independence Week since we missed over the weekend when it actually happened.
Yeah, I really enjoyed the Independence Day because the Ghana under 20 national team scored their or took the cup for the West African or the African Cup that was played on our Independence Day. So that was like a joy for me. So I really celebrated it.
Oh, that's good. That's good. I wish I knew they were playing. I would have watched it. They didn't do
Something,
much that day, but
some things are for
hopefully,
men.
say it again.
Some things are for men only.
I know. I know. So have you received your vaccine yet?
No, because I'm 1C, they categorize us into 1A for the elderly, the at risk, and the 1B for the frontliners, health
Mhm.
workers. For the 1C, it was like other health workers, but not like frontliners. So I don't want to cut the line. So I'm waiting for others to have it.
Okay. I know PG, I don't know about other counties in Maryland, but PG County is having it at Six Flags. And I passed it the other day and the line was beyond long. It was insane.
Mm.
But people were waiting patiently because they knew how valuable
The
the
vaccine.
vaccine is. Yeah. So I guess if folks are in the 1C category, they are getting the vaccines now. So if you have not registered, please do pre-register, and you can just go on your county's website, COVID-19 website, and be able to register. Because the numbers back home remains high. But I also heard that they are getting their vaccines in
Yeah,
Ghana. You
they
heard
are
that too?
getting the vaccines, and I think I'm so happy that they're also patronizing it. I mean, people are getting the shot, and like everywhere you go to social media, you go to all the other networks, like it's all over. I mean, people are taking the shot, so
Mhm.
it's so encouraging, so
It
encouraging.
is, yeah. So I think we should still try to get church members who have received the vaccine, if they don't mind sharing their experiences with the church community and viewers,
Mhm.
especially on this program. I think that will encourage others to also try and get the vaccine if they haven't already
Yeah,
received their vaccine.
yeah, I'll work on it. I'll work on it, and then try
Okay.
to mobilize as much as we can to come on the program to talk to us about their experience with getting the vaccine. And maybe very soon we would also receive ours and then we can come on and then yeah.
I know. We'll try to have our pictures taken while we're getting the vaccine, to be
Yeah,
able to show it to others as well. And we always, Dr. Eddie and I will recommend that you do talk to your healthcare providers. I know that we advocate for you to get the vaccine because we know how important it is for you to have it to save your life. But you do have to talk to your healthcare provider to make sure that you actually qualify to get the vaccine. So I guess we can get started with this evening's program so we don't have our guests waiting too long.
okay.
So, as I mentioned last month, the upcoming programs are centered around key components of the 9 dimensions of wellness. So, this month, we will focus on mental health and financial health, as well as issues related to immigration. All of these are essential to our overall well being. So today we are focusing on mental health. Mental health is something that people don't typically want to talk about or affiliate themselves with, especially in our culture. But it is a health challenge that is experienced by most people, especially in this country, due to the high demands related to social and economic factors. And children also experience mental health challenges as well. And it's nothing for us to be ashamed of. And so we have to learn how to deal with it and how to address it, especially if it comes to us. COVID-19 has also brought its own challenges and has compounded on the effect of mental health. So I am so glad that we have Mrs. Denisha Hamilton, a sister of mine, who is well versed in this topic, for her to share her professional expertise on mental health. But before we get started, we want to thank our last speaker, Ms. Laura Lottersville, for her excellent presentation on how to prevent or minimize inflammation with food that we eat. Laura gave plenty of tips on how this can be achieved. And if you haven't watched the program with Laura 2 weeks ago, we do recommend that you do watch it. And as usual, we always tell you to share the program with others. So let's get started, Dr. Eddie, with this evening's discussion with Miss Denisha Hamilton. Hi, Denisha.
Hello, hello.
Thank you again for joining us for the program. How are you?
I'm good. I'm good. Thank you for having me. I love and am very passionate about educating our community on how to take care of their mind along with their body and spirit.
Mhm. Yeah, we certainly are grateful that you were able to take time out of your busy schedule and your own practice to join our program this evening. So before we get started with the questions with our viewers, I just want to ask you as to why did you decide to get into mental health, be a mental health specialist, I should say.
So this is always an interesting question whenever I get it because I don't think I came about it in a traditional way. Um, so not many people know this, but my father was murdered when I was 5 years
Oh
old.
no.
And I'm the oldest in my family, and my family just kind of talked to me about staying strong, keeping his memory alive. And I remember around 13-ish, I was watching a movie. I had never heard of a therapist before. I had never heard of a social worker other than through CPS. And it was a therapist in a juvenile detention center. And she had these kids that were so hardcore in the street, like committing crimes, but she was breaking them down and connecting to them in a way that I just thought was fascinating. And I remember looking at my cousin and I was like, I'm going to do that. I'm going to be someone that people can talk to and people can just lay their burdens on me and I'm going to help them. And I remember feeling blessed and burdened at the same time that I didn't fit any of those statistics of having a single family, having a father that was murdered. You know, I used to watch a lot of Maury Povich, terrible, but I remember watching the shows and it was all this like, oh, these girls are doing drugs and they're promiscuous. And I remember thinking, you know, if there's something in me that I can help other people who have struggled, but not fall into all of these negative statistics, I want to be that light. I want to be that gift. And I stuck to that path and I love it.
That's what I was going to ask you. Have you found it rewarding or challenging?
It is. This past year has been the most challenging of my entire career, but overall, I find it extremely rewarding. A lot of my work is with teenagers and young adults, so they don't tend to say, "Oh yeah, Denisha, thanks for kicking me in the butt with your words." But every once in a while, I'll get a text message from a former client that will say, "I didn't know that I didn't think I was going to live to see my 20th birthday, and I'm turning 21." Or I'll get a text from someone that says, I would have given up on myself a long time ago. Just thank you for believing in me. Or I'll have parents that will reach out and say, just thank you for listening to him or listening to her. Thank you for listening to me and really helping me to be a better parent and really understand what's happening. And so those things are extremely rewarding to me.
Yeah, I think people don't realize that you don't necessarily, depending on the clinical setting that you're in, you don't necessarily treat the patient. You treat an entire family. I remember dealing with cancer patients. It wasn't just the patient themselves, but their spouse or their children, grandparents. Everybody becomes part of their care.
Everyone's your client. Yep.
Exactly. Okay. Well, before we get into our discussion, let me go ahead and let our viewers know about your extensive career.
Okay.
So Miss Denisha Hamilton is a licensed clinical social worker. She's an excellent therapist, then can work with many issues and is particularly skilled in working with teens and young adults. In 2016, she won the Loudoun County's Best Counselor for Kids. Denisha has been providing mental health treatment in Loudoun County for 16 years. I know she doesn't look like it, but she's been doing this for quite some time. She has worked closely with school officials, probation officers, Department of Family Services, and numerous other agencies to coordinate services. Denisha goes out of her way to create a comfortable and safe environment where children, adolescents, and adults feel supported in implementing change in their lives. Denisha's philosophy to therapy is that life is a journey, and any impact she can have on helping a person through that journey is an honor and privilege. Denisha aims to help people understand and accept themselves and move forward and move towards the life they deserve. In 2017, Denisha opened a mental health practice, which is her own, and it's called Journey to Wellness. The new name of her business provides individual, family, and group therapy, as well as focusing on community engagement to decrease the stigma around mental health and encourage people to take care of their mind, their body, and spirit. So once again, we're pleased to welcome back Denisha to our program.
Thank you for having me.
Thank you again. So Dr. Eddie, if you, okay, perfect. So we can get started with the program. So audience, if you're watching the program, this is going to be a chat format. And so if you have any questions, please feel free to put in the chat box and Dr. Eddie will project it for Mrs. Hamilton to answer your questions. So just to start off, I know that mental health, people view mental health in different ways.
Mm-hmm.
So how would you explain what mental health is?
So mental health to me is along the same continuum as our physical health. And so the same way that we get our eyes checked every year, we get our teeth checked twice a year, we see our physical health doctor. This is also just taking care of your mind. So we all have stress. We all have anxiety. We all have sadness. We all have depression. We all feel overwhelmed at some times. And so to me, when I speak about mental health, it really is just taking care of, it's the self-care and learning coping skills and really just making sure that you're not allowing stress to eat away at your brain or at your body, because we know that stress also has physical symptoms with it.
Yes, I think when people think of mental health, they just automatically assume someone has some kind of mental disability or mental challenges, but not necessarily
or you're crazy.
Oh, you're
And
crazy.
that is not the case. Like I have so many clients that just want someone that's impartial to talk to them, because they know if they go to their brother, their sister, their friend, they're going to get a very skewed view of how they should move forward. Where if you're coming to me, I like you, but I'm not invested in what's happening in your day-to-day life. And so and I focus more on helping clients develop their own goals and helping them reach those goals. So I'm not telling you what to do with your life. I'm helping you figure out what is the best move for your life. And we don't normally get that from the people in our inner circle.
That makes perfect sense. Growing up, when I heard someone had a mental challenge, it had to do with someone who may have schizophrenia, walking around nude or, talking to themselves and things like that. But people do not equate life challenges, stressors. Some people may go have headaches and not necessarily link that to stress-related event. And so I was curious as to what, as a specialist, how you view what mental health may be. So in terms of that, what would you say is some of the warning signs that people should look for?
So I think when we're talking about teenagers, I always say to parents, your kid. So if your kid is sleeping more, if your friend, even for adults, if they're sleeping more or sleeping less, if they're not engaging in activities that they used to enjoy, if they are isolating themselves, changes in appetite, or just feeling not the same. I have a lot of clients that will come to me and just say something feels off, but I don't know how to put my finger on it. That's a great time to just go and talk to someone. Just like when we have a physical health symptom, like if I have a cold, maybe I will go to a doctor, but if I'm having the flu or if it's worsening, I might definitely go to a doctor. So there's nothing wrong with just having an evaluation or saying, I feel like I'm a little concerned. I don't know if this is something I need to worry about or not. And just having a professional say like, oh no, I think that everything's okay. Or you know what, this could really be beneficial to you. I think sometimes people are waiting for something to be wrong. And sometimes it's not necessarily things that are wrong, but they just don't always feel right.
Mm-hmm. Would you say that some people may, like eating habits may change, whether it's weight gain, weight loss, and that could be related to some kind of stress that they're going through, but they may not necessarily think it's related. They may just think.
Food is a comfort because it hits the pleasure centers of our brain. And so when we're stressed, when we're angry, when we're sad, when we're anything other than happy, and sometimes when we are happy, food becomes a comfort and becomes a source of pleasure for us. And so eating typically, changes in diet are typically a warning sign. And sleep is another big one. It's very easy for our brains to say, you know what, we're tired, go to sleep. And we will make up excuses for why we should be tired. Oh, I ran today, or oh, I worked really hard. My boss was really mean to me today. And so let's just take a nap. And you find that you're sleeping and kind of avoiding life events a little more often. That's been one of the scariest parts with the pandemic, because so much of what we're supposed to do to stay physically healthy is not great for our mental health. So sitting in the house and having, your whole life just revolve around one area is devastating for a lot of people. Not being able to engage socially the way that you would want to, not being able to enjoy the activities that we once enjoyed or do the things that we used to do. So there's been a large rise of depression and anxiety. Unfortunately, suicide rates have also gone up. Substance abuse rates have also gone up during the pandemic.
Yeah, my next question was going to be, how has the pandemic affected or contributed to people's mental health, and in terms of the challenges they may have? I know that with teenagers, it has been difficult because they haven't been able to socialize with their friends and some family members even, and some may not be doing well in school because they're used to having that face-to-face interaction in the classroom, but now they have to learn on their own, especially if a parent is out of the home working. So what would you suggest you do with a teenager that's having difficulty coping with social interactions during the pandemic?
So what I love about this generation is they are so much more open to mental health than our generation or our parents' generation. It is much more normalized for them than it ever was before. And so I'm a big fan of just open communication. Like, you go to your child, I know this is difficult. I know you're having a hard time. Is there anything I could do? Would you like to have someone to talk to? I think having a church family that you can talk to is great, but sometimes teenagers are like, well, I don't want to lay all my burdens on this person, and then I have to see them on Saturday or Sunday morning. And so I think just offering it, because it's been difficult for adults and for children. I know for me, it was a lot of adjustment just being in the house. And even though I was working, so I had some sort of a schedule, it also was like, well, my home was my safe place. This was my sanctuary. And so now I've taken work stress and brought it into my home. Students have brought their school stress into their home. And so their bedrooms, where they associate with relaxation, are now the place where they do their homework, where they have any kind of social meetings. Everything's happening virtually. And so it's taking most of us kind of an adjustment of, okay, how do I have some resemblance of normalcy in this world that doesn't feel very normal? I think it's also acknowledging for each of us that we're allowed to grieve what we've missed out on during this pandemic. And I feel like a lot of people have really struggled with just calling this grief. We have missed out on holidays. We've missed out on special occasions. We miss hugging people. We miss traveling. it is a sense of loss. And it's okay to just say, this is sad what we're going through. And we're making the most out of a really difficult situation that none of us have a playbook for.
Yeah, I think one of my major concerns is those who may have felt safe outside of their home.
Mm-hmm.
So whether it's teenagers or adults, sometimes, for adults going out of the home to work felt safe to them, especially if they were going through abuse or something in the household.
Correct.
And teenagers going to school may have been safe for them from an abusive parent. But now everybody has to congregate in the same household, whether they like it or not, because of this pandemic. So what would you suggest for an adult who perhaps had their sanctuary being outside of their home, but now kind of forced to be in the household? Like how should they cope with that?
So trying to find other social outlets is a good thing. So, maybe there's a neighbor or two that you can go for a walk with, or I have some clients that have set up little like study pods or friendship pods where maybe 2 or 3 people get together and kind of rotate. So we'll all study or we'll all work together at this home so that we're not constantly looking at the same things. I think also just checking on your friends. Like a quick text message goes a long, long way of, how are you doing? Do you need anything? There are some social media groups also where people can kind of reach out for help. And I know every county, at least in this area, in the DMV area, we have community service boards where if you are struggling with any sort of violence or things like that, you can reach out and get services. That's a big step that a lot of people are not prepared to take. But some of it is just finding ways to get out and have a breather. And so if you become the person that goes grocery shopping every day, mask up, be safe, but at least it gives you that little bit of fresh air and that little bit of separation from the turmoil and tension that you might be dealing with at home.
Yeah. Let me ask Dr. Eddie if there's any question before we keep talking away. Dr. Eddie, do we have any questions yet?
No, there's no question yet.
There's no questions yet. Okay.
So continue.
All right. Keep talking. Okay. All right. We'll keep. Denisha and I know each other, so we'll just keep talking. So, in terms of finding a therapist, obviously there are many folks who have multiple credentials. You have those who did psychology. You have those who did social work. So how do you find a therapist, and what should you actually look for in terms of their qualifications?
So all of the qualifications kind of lead you to the same end result, but the training is very different. So for example, for me being a licensed clinical social worker, my training was much more focused on helping the community and the person as a person in society. So when you're helping the individual, you're helping everyone around them. And so you can't treat people in an isolated bubble because that's not how we live as humans. But and for, let's say, a professional counselor, a licensed professional counselor, their training is much more focused on techniques like theories and how you apply those theories to everyday life. Then you have your psychologist. Like you said, psychologists typically do more of the testing to see if there's any underlying issues that we're not aware of that are impacting your day-to-day behavior. You have psychiatrists who are the people that prescribe medications. And then there's a bunch more. There's LMFTs, all kind of stuff. What I recommend to people is one, if you're looking for a therapist, the greatest person to talk to is either your child's school or your primary care doctor. Your primary care doctor typically has a pulse on what's happening in the community and will typically have a few resources for you to look at. The actual credentials don't matter that much unless if you are struggling with marital issues, you might want to see a marriage and family therapist. But any of all those letters I just threw out can basically do around the same thing, just the specialization's a little different. There are different websites like Psychology Today, where you can actually look at a picture of the therapist and read a little bit about them. I find that that helps a lot of people to feel like they're connecting with the person before they actually have their first appointment. There are websites like Therapy for Black Girls and Therapy for Black Men that are more specific to connecting Black clients with Black therapists, because I do think from a cultural perspective, we have struggles and we go through things that you don't necessarily want to explain to someone else. And sometimes that becomes a hindrance in a therapeutic relationship. The biggest thing when you're looking for a therapist is one size does not fit all, and it is okay to advocate for yourself. The biggest change and the biggest predictor of change in a therapeutic relationship is the relationship. If I like you and you like me, we're more willing to grow and change and work well with each other. And so if it doesn't feel right, don't stick with it. Now, this could be because I'm a New Yorker and I argue about everything, but I'm a big fan of no one knows me better than me. So whether I'm with my medical doctor, whether I'm talking to my own therapist, whether I'm at the dentist, like, you don't know me more than I know me, but you can help me understand me in a better way. And so if I feel like you want to tell me what to do and not help guide me, that doesn't work for me. So a lot of it, it's okay to say, you know what, this isn't a really good fit and I'm just going to keep looking. But I'm a big fan. The Community Service Board is another really good outlet because they typically have a resource list. If you have friends that see a therapist, you might say, like, well, what do you think about your friend? I find that my biggest referral base really are my current clients, where it's like, oh, I met someone at the store and I told them about you, or I have a friend, I have a cousin, I have a family member. So, and that's okay. As long as the two clients are okay, then it's an okay thing to do. Mm-hmm.
Yeah. So like if you see a client and they, tell you what their issues are, do you typically give them like a task to complete so that you know that they're improving on whatever issues that was brought to your attention? Or is it just typically just a conversation, or not necessarily like in a task that they have to accomplish for you to know that they have been successful in their therapy?
So every therapist does this a little differently, but I always set up treatment goals with the client. So when I have a client come in, I first give them paperwork because the state requires it. So it's a lot of background information. And on my paperwork, there's a section for talking about your current goals and what brings you to treatment. And so I will have a conversation of, okay, let's talk about what you like to work on. Well, and also, how do you know when you've reached that goal? So for example, if it's, I want to lose weight. Okay, well, what weight are we looking for? Typically, it's not quite that cut and dry. I usually get things like, I want to have better coping skills. I want to improve my boundaries. I want to communicate better with the people that I love and I care about. I want a new job. Okay, so let's define what those things look like. And then every year we go over the treatment goals. So this is what last year looked like, and what do we think we want to work on next year? Do we decrease sessions? Those sort of things. I also give assessments. And so I will send assessments out and, let's rate where you are now. And then I typically do a 6-month check and then a year check.
So do folks typically need a referral to see a therapist, so they can kind of just call and go in, or without a referral from the primary care doctor or pediatrician for young adult?
So much of that depends on the insurance provider, but most of the time you do not. And I will say a lot of insurance providers have been really amazing during the pandemic, where they have waived co-pays because they know more people are seeking mental health services. So they've waived co-pays. They're allowing teletherapy, where a lot of plans did not include teletherapy in the past. So typically, no, you don't need a referral. But again, it really depends on the plan. There are some plans that also will limit the amount of therapy you can have. Like it will say you have 12 sessions, and most therapists are pretty well versed if they're accepting that insurance provider with what paperwork needs to be filled out to continue. So if we're not done in 12 sessions, it's okay. I have the paperwork that can extend it for another however many sessions.
Okay. So have you found that with telehealth, are people more likely to be open? Or do you think that the face-to-face interaction was much better in terms of therapy?
So I feel like that depends on the person, but overall, I think it's been smooth. I think with the younger generation, they already used their computers and their phones to connect with people. So their transition was much easier. And I actually provided teletherapy before the pandemic. So the transition was also a little easier for me. I find that most people, because they're in their home, they're much more comfortable with what they're talking about. The hiccup to that has been we're all home. So trying to find a private place to have a conversation where you can really just let your hair down and talk about the things that you want to talk about without worrying about, did my husband or my wife hear me? Will my kids walk in? That's been a little bit of a challenge. But I found that for most people, they like that they don't have to worry about a commute. Because we know this area is insane with commuting. So not having to look for parking and just the freeness of it. Like, oh, I can go for a walk and talk to my therapist at the same time. I can make dinner and talk to my therapist at the same time. And that seems to work really well, especially for a lot of adults.
Okay. I know earlier you had mentioned that the rate of suicide has gone up. Particularly during the pandemic. So if someone was to have a session with you and is quote unquote suicidal, like how do you deal with that?
So I ask a lot of questions and I normalize it because suicide is our brain's kind of auto shut off. So I don't know if you've ever left your phone out in the sun for too long and it just turned itself off because it overheated. That's basically what happens with our brains. So when we're in a situation where we feel like this isn't going to end, I don't know when it's going to end, I don't know what to do, our brain is just like, oh, if we were dead, we wouldn't have to deal with any of this. And so a lot of people don't want to actually be dead, which a lot of people are confused by that. Their brains are saying we should die, but that's not their actual feeling. They just don't have another way of trying to figure out how to deal with their situation. So when I have a client that comes to me with any kind of suicidal thought, we just talk about it. Let's normalize it. Like, so what are you thinking? Do you have a plan? Do you have any intent on following through if you do have a plan? And what do you need? What do you need to make it through till tomorrow? What do you need in place to make it through until next week? And so we used to call that a safety plan. And so you safety plan and just come up with some different resources. I've had clients that have said, if I go home, I don't know that I will be safe, Denisha. And then we talk about hospitalization. Because at least we know at the hospital, if there's any medication management that we can put in place, we know that's going to be put in place. If there's constant supervision, so that the likelihood of you hurting yourself is reduced. And for some people, they just like the idea of all I'm focused on for however many days I'm at the hospital is just my mental health. I'm not worried about what are we eating for dinner. I'm not worried about turning in school assignments. I'm not worried about all the things that distract us from just taking care of us on a daily basis.
Okay. And how about abuse? Like if a woman or a man, I think typically folks attribute abuse to just with women, but what if a male or a female comes to you and say, I'm Hamilton, I'm going through an abusive situation. Like, how would you handle that? Or what advice would you give them?
So I'm a big believer when anyone comes to me, I don't believe it is my job or responsibility to take their voice away. So when you have a situation like someone in an abusive relationship, so much of their voice has already been crushed. And so for me, it's helping them find that voice. So you tell me what you'd like to do, and you tell me how I can help you. I have resources. We can put a plan in place. For a lot of women that I've worked with who have been in domestic violence situations, it's been more of the safety plan at home. So if he comes home and he's got that look on his face, you tell me what your next step is. You know, do you have a phone that you can have access to? Is there a neighbor that you can talk to? Because a lot of people, and this also confuses people, like, well, why won't they just leave? If it's that bad, why don't they just leave? And for most of us, we will stay in bad situations because we know how to work with the bad situation. The unknown is terrifying to most of us. It's why we stay in bad relationships. It's why we stay at jobs we don't like.
I was about to say the same jobs for decades.
Exactly. Because you understand it. Like, okay, it's that saying of, at least this is the devil I know. I don't know what happens when I walk out that door. And so for me, a lot of it, do we have a question, Dr. Eddie?
Yeah.
He popped over, right?
He did.
So someone is asking that she went for a therapy and she was asked to keep active. I mean, in these times of COVID, how is she going to keep active?
Okay. So that's a good question. So sometimes keep active, we assume that means like go outside or go
walk around,
go to the gym. I'm a big fan of just finding ways to do things in your house. So for me, I was diagnosed with a blood disorder 7 years ago. And what I realized is when I was at work, I had to constantly move every hour because I was walking clients to the door. I was walking them to my office. So I was moving. When I started doing teletherapy, then I'm just sitting and I'm logging in and logging off for hours. And so what I do now is I stand up. I walk stairs, I walk circles sometimes, like especially with the weather being bad recently, I will just literally do laps. Like, okay, I'll walk from the front door, I'll walk around the living room, I'll walk. So active doesn't mean be outside. It just means get off the couch, much more than what many of us are doing. Exercise is also really good for releasing endorphins that just help us manage a lot of mental health issues. And so being able to keep your body moving and feeling like you're accomplishing something is so therapeutic for the brain.
To add to that, doing something you are good at, how does it help?
What was that? Sorry,
doing something that you are good at, how does it help?
So it helps because we all want to feel like we matter and that we're working towards something, and that it's a self-esteem booster. So when you're feeling good about what you're doing and what you are providing to the world and to the people in your world, it just helps you feel a little bit more connected. The scariest part for any human is feeling like they're disconnected from the people that they matter. That's where you get the depression and the suicidal thoughts coming in. I think the harder part is figuring out, well, what is the thing that I'm good at and how do I discover that thing? So what I typically say to people is you just try something. And if it doesn't work, you try something different. So let's say if you have always thought about skateboarding, get a skateboard, go skateboard. If it's terrible, sell the skateboard to somebody, find something different to do. But the biggest thing, and that's where our brains get really tricky because it will keep us hostage, where it's like, well, you're not going to be good at that. So don't even waste your time. Or remember those other 3 things that you tried and you really weren't good at it. So why are we going to try a 4th thing? But as long as we're moving toward that goal of figuring out what we're good at, then you're doing the right thing. So if you weren't good at those 3 things, you don't know that the 4th thing won't be your thing, because if you don't try it.
Yeah. So Eddie's back again.
Yeah. To add to it, someone is saying that she went for a therapy and she's been told that she should do something or take care of others. But she is saying that I'm not mentally stable. Why do I have to be taking care of others? Or I have an issue, and you, the therapist, is telling me to take care of others. How is it going to help me?
Okay, well, that's a good one, Dr. Eddie. Thank you for that. So this is what I would say. Therapists are people like any other person. And so sometimes a therapist may have a tool bag of things that they're kind of throwing out to see what sticks. It is okay for you to say, yep, nope, that's not going to work for me. I worked with a psychiatrist. I worked with a psychiatrist one time, and his prescription used to be, you need to hug people more. This is, of course, pre-COVID, but it was, oh, you're depressed. You should hug your mom more. You should hug your cousins more. And I remember my clients being like, this is the most absurd thing that I've ever heard. So if that technique doesn't ring real or true for you, it's okay. What I would say is that you communicate that to your therapist. Like, why do you want me to do this? If I'm here and I'm dealing with my stuff, I'm having a hard time understanding how hugging another or doing something for someone else is going to benefit me. So can you connect those dots for me and help me understand that? Because maybe they have an insight or they're seeing something that maybe you haven't seen. But it's okay to ask those questions. It's also okay to say, I don't know that that's going to work, or I feel like that will deter me from really focusing on me, which is really what I want to do right now.
Okay. I guess leading into that question. So if you know someone that does need help, whether it's a friend, a child, any adult that needs an encouragement to seek a therapy, how can we suggest that they do that? How can we be helpful?
So sometimes the word therapy scares people. And I'm super grateful for all the questions. Thank you guys so much, because I cannot tell you the number of times. And it's like, well, I'm not going to say anything to the therapist because she might think that I'm crazy or I need a therapist. And that's not the case at all. I think sometimes just talking to people and saying, you know, I care enough about you, but you seem to not be yourself. Have you ever thought about talking to anyone? I'm willing to help you find someone, you know, I'll drive you to an appointment. Sometimes just putting it out there is the best recipe, because I think a lot of people think that they're hiding it really well. And those of you that are wives and mothers, we're good at that. Like, we don't want anyone to worry about us. And so it's putting on that brave face, even when you're hurting inside. And so I think as people, we believe that as long as I smile, then other people will think I'm okay. And so sometimes you just need someone to say, like, you don't seem like yourself, or you don't seem like you're okay. And I care enough about you to say, like, can we go talk to someone?
Okay. Dr. do you have a question before I ask my next one?
Do you want to go with your next question?
Well, I was gonna follow up with that. Like, how do we know when someone actually do need help? Because you mentioned the signs and symptoms beginning of the program, and I'm wondering whether we should just base solely on that, saying that someone is going through this and going through that, so they may need help, or is this something else as someone who's standing back to see? For us to, you know, observe and say, okay, this person really does need to talk to someone.
So sometimes it's just little changes in behavior, or sometimes it's just a sadness that you see in someone's eyes, or just a feel that you get from someone. Like, I can remember sitting in church and just feeling like, with no words being spoken, like, this person feels like they're going through something. They feel like they've got something heavy on their chest. And sometimes it's just like, are you okay? Do you need anything? Can I be of any help to you? Because sometimes it's not the warning signs of I'm crying or I'm isolating, or if it's a friend that you're really not seeing that often, you may not know what their day to day. But I do think that we all have that sensory thing in our gut where you just feel like something's not right, and just being able to give voice to that and say, like, oh, this, like, let me pay attention to what this ping is.
Okay, Teddy.
So, I think I have something around the explanation you gave. So in this time of COVID, I mean, most of us are indoors, and we are all about social media, keeping company with social media. Now, a therapist says that don't live on social media. Why would that therapist tell me not to live on social media?
So this would be my guess, that most people go on social media for the wrong things. And so I say to people, we compare our insides with other people's outsides. So you're looking at people living their best life on social media, and you think that that is their everyday thing. And I have a lot of clients that are like, well, look at these 3 people getting together, or look at how they did this, or they took this family picture. Their family is so well together. And then you start judging yourself. So I'm wondering if that therapist is saying, don't go on social media if you're going to judge and compare yourself, because that's not good for your own mental health. I think that social media is a great way of staying connected, as long as you can put it in the appropriate context. Any of us that use social media know that before you post a picture, you have taken that picture 70,000 times to make sure you got the right angle and the right lighting, and you're looking your best. And that's what you're presenting to the world. So I would just say, just remember that other people are doing the same thing, that they are trying to present their best selves to the world. And it's important for you not to compare that.
Yeah, I think people see exterior and assume that that person has it all together. They have no idea how all, how things come to play.
Correct.
In the end.
So we've got a question.
Yeah. What if the person will not let you help him attempt aggressive behavior?
So what I would say with that, and that's a very good question, and that's a common thing. I would look for the right person to have that conversation with the person. So for example, if I'll use me as an example. Let's say if my brother and I are arguing, I might not be the great, or my mom. If my mom were to say to me, hey, Denisha, I think you need to do this. I love her, but I'm more likely to argue back and forth with my mom. But maybe if my aunt, if my godmother, if someone else. So I would say, maybe if you're having the conversations about help, you may not be the right person, and that's okay. That is not a ding at you or your relationship. We hear things differently from different people. And so I have parents say to me all the time, like, I literally just said to her the exact thing you just said, but I'm not mom. And so it sounds different when it comes from me. So I would say, thinking about the person that you're trying to help, and try to find someone that they may be more inclined to listen to, and have that person like sit them down and say, what's going on, and can we look for some help?
So culturally, we are probably very private. And so assuming it's a husband and wife type of situation, and the wife feels like she's not able to help them, but yet if they kind of tell someone else, they might get in trouble because the husband may be private. So how do you deal with that?
So that is a very, very big one in our community. Very big, because I think that the African and African American community has been more closed off. We want to pray about things, and I'm all for you pray about it, but we can also do something else about it. A lot of it is, I think we also want to be someone else's everything. So let's say, for example, if your husband was diagnosed with cancer, it would not be your responsibility to cure their cancer. You would say, you need to go to this doctor who is trained in this way to deal with this. There is nothing wrong. It is not your fault, but this is the treatment, and this is how I support you while you get your treatment. I would say it's the same thing when it comes to a mental health issue. So let's say if your husband is depressed and wants to go talk to a therapist, it's not they're talking to the therapist because they can't talk to you. They may not want to talk to you because they don't want to burden you with what they are going through, or they don't want you to worry unnecessarily. And so the same way that you would support them with their treatment for cancer, you support them in their treatment for depression. I support you going and talking to this person, and you let me know if there's anything that I need to do.
Okay.
And I think,
sorry.
What if the person refuses to accept that something is going on with them? That is another good question, because people often don't see themselves the way other people see them. And sometimes as the support person, you might decide that you want to speak to a therapist to figure out how you best support this other person. And sometimes that's the way that you go around it, where I'm concerned about this family member who doesn't see this. Now tell me, what do I do on how do I work with this person? The sad part, the mental health laws in our country are not amazing. And so unfortunately, a person is allowed to not get treatment for the things that they want. What I think happens is that the support system then makes their lives a little too easy, so that they're allowed to continue to not get help. So if you think about someone with a substance abuse issue, we all know that we need them to hit rock bottom before they get help. The same occurs, sadly, a lot of times with depression, that we need the person to get to a place where they're so uncomfortable that they want to go get help. So sometimes the work is on us and saying, am I making their lives so comfortable that they don't see that they have a problem and they don't see that they need any help?
You're on mute, Dr. Eddie. Okay, perfect.
How do we deal with stigma?
That is a great question. I think the stigma is starting to decrease, especially in the Black community. I think that we are realizing that we are allowed to have a variety of emotions, and that the same way that we don't judge physical health issues, we should not judge mental health issues. Our brains are the strongest organ that we have in our body. It literally controls everything else. So if your heart can go out, if your eyes can have issues, if your feet can have issues, why would we not think that your brain might have an issue or two? And so the way that I say to people of dealing with that stigma is just kind of normalizing it for yourself. How do you make it make sense to you? Because if you feel crazy, if you judge yourself, then how do we normalize that for other people? I'm super grateful for programs like this that are willing to just have the conversation of, it is okay for us to take care of ourselves. And that is not a bad thing. I think it's important to be mindful of who you share your information with, because I think that that also leads to the stigma. I think that we all know the people in our lives that will perpetuate that stigma. And the same way that every time we go to a doctor and get a diagnosis, we don't run around and tell everyone we know. We don't have to do that when you're seeing a therapist either. That doesn't have to be anyone's business. But I think it really is knowing for you that there is nothing wrong with not being okay. We are not made to be okay every day through every situation.
So, go ahead, Eddie.
Yeah, so I was like, to add to it, that's my last question. Right?
No, you can ask more.
So, how do we, around somebody who has mental issues, behave? Like family, institutions, friends, how should we behave?
So that's a good question. So a lot of it depends on how that person presents their mental health issue. So sometimes we have to be supportive. Sometimes we have to have really strong boundaries. Boundaries, I would say, are probably a big one for most mental health issues. But sometimes, dependent, I think for me, when I say mental health issues, I'm thinking about so many different things, from the person that just needs a person to talk to schizophrenia. And so it's such a vast array of things that we need. But a lot of it is, one, making sure that you're comfortable. So if you feel uncomfortable, you shouldn't be doing whatever it is that you're doing. So even if that person wants you to do it, I think it's educating yourself. If you have a person in your family or a friend that has a mental health issue, you want to try to understand it as best as you can. Again, with a physical health issue, when I got diagnosed with my blood disorder, my whole family started doing research and everybody wanted to come to the doctor, because how do we support Denisha and understand what is happening for her? So really, if the person is willing to share with you, like, oh, I've just been diagnosed with bipolar disorder. Okay, well, can you tell me a little bit about that? What does that look like? What should I be concerned about? How do I help? All of those things. And again, it's okay for you to see a therapist to say, hey, my cousin just got diagnosed with this, and I really need some techniques on how to handle that, so that when we're at family gatherings and things, it doesn't feel uncomfortable, or I don't feel ill-equipped with dealing with that. That's okay to do also.
So I had a question about as a caretaker, like if someone's a caretaker, how do they know that they are not enabling the behavior? For example, if someone has a substance abuse that you feel like may need to seek therapy, how do you know that you're not necessarily like helping in terms of getting whatever they need, but how do you know that you're not enabling them not to seek help? Because you may also accept the issue and think it's okay. So then how do you then guide them to seek help? Does that
So
make sense?
yes. So some of it, I think, is when we are enabling behavior. So some of it is, if the behavior isn't changing, then we need to look at the two people in the relationship. So sometimes it's easier to say, oh, you're an alcoholic and you're always asking me to go get beer. You shouldn't ask me to go get beer for you. But now I also have to look at myself, because why do I keep going to the store and getting the beer for you? And so sometimes if there's a problematic behavior and it's not improving, is looking at the person and why they're stuck, but also looking at all the surrounding factors around them to see if you may be helping them to stay in that stuck position. I think one of the hardest things when we have a relationship with a person that does have a mental health or substance abuse issue, it really is hard to watch someone struggle and not dive in to help them. But sometimes, a lot of times, we can't. We've got to let them fail and let them learn from that failure.
Okay. So that's a question, because if someone's being abused and they feel like there's a reason why they're being abused and therefore they're not able to seek help for themselves or the abuser, then it just becomes a repetitive pattern of living in it. So just curious about
that. And
a
lot of times for people who are in an abusive relationship, we all know, again, when we trust our guts, we all know when we're in a situation that's like, this is not okay. And so a lot of people will just get to their breaking point where they'll say, like, I can't handle him or her hitting me one more time. I can't handle him or her getting so drunk that they embarrass me or they pass out. Like, I just can't handle it anymore. And then that's when you know, like, okay, now we can put some interventions in place.
Okay, so we have a question. How can you encourage people, I guess, who are non-compliant with psych medication, something we see with people dealing with paranoia and hallucinations?
That's a good one. And that is a very common problem, because a lot of people, just like with any medication, we start feeling better and we don't want to take it anymore, or we don't really acknowledge that we needed the medication in the first place. So some of it is helping them see themselves with and without medication. And sometimes that can't be a family member. Sometimes it has to be a trained professional to just say, when you're taking this medication, this is who you are. You're going to work, you have healthier relationships, your communication is so much better. When you're not taking the medication, then look at what happens. Unfortunately, with paranoia and hallucinations, it's a much more difficult thing because their brains just aren't here with us. And so sometimes how we get around that is injections rather than daily pills, because they will not necessarily remember or see the value with the daily pills. But the injections, and most of the injections are weekly or once a month.
I was going to ask, it can't be daily.
No. They're weekly or monthly injections, but the medication stays in your body and works for a longer amount of time. So then you're only arguing with someone once a month to get the injection rather than every day to take the medication. If it becomes so difficult that they are not manageable in a community, then sometimes looking at a higher level of care, like a group home or a residential facility where part of the mandate is taking the medication. Again, for family members, it's difficult because we all know how to get over on our family members. So if you're trying to get your son to take his medication, but he knows how to lie to you or he knows what to say to walk away from you, then that's much more difficult. And you don't get that from an outside family member.
Yeah. So there's more. Is there is there any one secret thing which can be taken to deal with a person in denial state?
So no, there's no one secret. But what you can do is, from a supportive place of just trying to help them see what they don't want to see. Sometimes denial is a fantastic coping skill because we're just not in a position to deal with the thing that we need to deal with. And so we will create all sorts of different reasons for why the thing is happening. Denial is also a symptom of grief. And so sometimes it is I'm sad and I'm not ready to deal with this sadness. So now I need to create a different reality for myself so that I don't have to deal with that sadness. So sometimes that your job is just kind of taking a step back and letting them kind of work through this denial on their own. Some of it is saying to the person like, no, you're telling me this, but I just saw this happen, or I just witnessed this, or last week you told me this, and really just making that connection of how their stories just don't align the way that they're wanting them to align.
Yeah. Dr. Eddie, do we have more questions before we let Ms. Denisha go?
No, I think we've exhausted all.
Okay. So I wanted to ask you, Denisha, in terms of local services, I know you live in Virginia and we're in Maryland, but do you know what local services that people can tap into if they have questions or seeking help?
So I would definitely say contact your local community service board. Or your pediatrician, your primary care doctor for services. You can also do a Google search. I mentioned Psychology Today earlier today. Psychology Today is nationwide, and you can put all kind of filters for area codes, race, culture, language, all of those things.
Okay. So if people want to reach you personally, how should they contact you? Is it via your email or?
Yep. Email is the greatest way because, again, with the pandemic, things are pretty hectic. So returning phone calls kind of gets difficult. But in between clients, I can respond to an email and at least set up a time for a phone conversation.
Okay. Well, thank you. Thank you, Denisha.
Thank you, guys.
This has been a very, very excellent discussion. I think our members, at least now, understand much better what mental health is about, how to seek help, and also how to guide others within their lives to find a therapist if need that. So
there's also an awesome training that I want to make sure I mentioned called Mental Health First Aid. And that's for any lay person to take that will help you feel like you have the tools to help another person in your community if you were to come across a person that needed any sort of mental health assistance.
Okay, thank you. And we hope you were able to join us next time for another discussion.
Absolutely, anytime.
Okay, thank you. Have a good evening.
Thank you. You too.
All right, speak to you soon.
Yes. Bye-bye.
Bye-bye. This has been great, Dr. Eddie. I'm hoping that people will watch it and be more open-minded when it comes to mental health and seeking therapy if need be.
Seeking therapy, that is the most important thing.
Yeah.
So and recommend to others to watch it and then see and ask where they can seek therapy. That would be so much appreciated.
Yeah. So on that note, I think we ran out of time. So let me just remind people that to please, as Dr. Eddie mentioned, share this link with others as they too may benefit. So Dr. Eddie and I will be back in 2 weeks with our new guest on immigration, and then the following week on financial health, and as well as other topics. So as usual, if you need to contact us, if you have any suggestions or questions, we ask that you send the email to emcuandyourhealth@gmail.com. Again, that's emcuandyourhealth@gmail.com. As always, please continue to stay safe, wear your mask, wash your hands, and social distance. And if you are one of the fortunate people given the chance to get your vaccine, we ask that you please do so. And we'll be looking for folks who've received their vaccines, and hopefully you'll be able to join the program and tell others how getting the vaccine went. We keep promoting the discussion with Dr. Abby as well as Dr. Eddie on COVID-19. That both presentations, I should say, is on the church's platform. So if you have not watched it, I suggest you do so. And I think it will guide you as you make your decision to move forward to obtaining the vaccine. So we thank you for watching and hope to see you next time. Have a wonderful evening. Bye-bye.